Hi, my name is Anton. I live in Gippsland, Australia. Many tumors or cancers are successfully treated with heavy ion radiation therapy, but only in a few countries successfully, which they have the facility to use heavy ion radiation therapy. It's only a few countries. Using this method, heavy ion radiation therapy, very often patient after therapy don't need any extra treatment like operation or chemotherapy. Job done, completed, relax, go along with your life, normal life. For example, for another type of treatment, like if you are treated with chemotherapy treating leukemia, which is a cancer for our blood cells, after chemotherapy, the patient usually needs to have a stem cell transplantation. I also accept taking insulin injection and the digestive enzyme. The patient without pancreas have to use it to survive and continue the life. It would be much better if the patient killed the cancer with heavy ion radiation therapy and then keep the pancreas and only cancer cells being killed. So it's better treatment, probably more expensive. You need to go to the special place, special country to do that. Taking insulin, for example, and digestive enzyme is just a prolonging the life for the patient for approximately 3 to 7 years. But if you treat your cancer with proton or carbon heavy ion radiation therapy, you can continue normal life after the therapy, after the full treatment and therapy. Some therapies for cancer using tablets or injection, which have a huge side effect, for example, loss of the bone density, risk of diabetes, heart attack or stroke. Some people put weight on, memory loss, or decreases the muscle mass. So using different tablets, injection, drugs to treat different cancer, I know it is opportunity to live longer and try to rid of cancer. Sometimes chance is big, sometimes not, because doctors actually experiment with different drugs which they are giving you to treat the cancer, and you are not know where you are standing actually. I have experience when my general practitioner treat me with different tablets, and I have side effects for very simple illnesses, and they didn't tell me they will change the tablets. So I don't trust them much. The combination of medications and drugs given to the patient with the cancer doesn't end equally, and there is a lot of uncertainty about the final result. The heavy ion radiation therapy, what I'm promoting, because I've been in Japan, I've been there, I know what the result is. I study a lot. This treatment kill just a tumor cell in the body if the cancer is not spread. through different organs, then you can't use this method. But it is in one spot, doesn't matter which organ is, brain or chest or lower parts of the body. You can use heavy ion radiation therapy. And result always will be perfect, positive, and you don't have any certainty after tumor treatment in one of those facilities. The most people, or the most who have experience about heavy ion radiation therapy is Japanese people, Japanese doctor in Japanese hospital. It's a 3 facility there which use this treatment for the patient. Another few, they don't use it, but still exist in Japan. And you have 2 in Germany, but they're much more expensive than if you go there than be treated in Japan. The heavy ion radiation therapy treatment targets exclusively the cancer cell and kills them. Which I already mentioned, the patient continue to run their own life after the completion of scheduled heavy ion radiation therapy without any stress, any uncertainty, any side effect, and any I will say, doubt for the future life. And if you want me to help you with your cancer treatment in Japan, you can contact me on my email, cancertreatmentjapan@gmail.com. That's my business name and email. And what they do, they treat the cancer with special machine from different angle. So they just damage the cancer cells, not surrounding tissue. The system or treatment much quicker than another one. But what we need to do, we need to have a MRI test, CT test, PET test or scan. So we send to Japan, they assess, they give us an answer or result, what they think, how patient will be treated, and if they accept our application, they will invite us to go to Japan to one of those facilities, and they will give us a schedule. We basically know the cost. The cost is basically fixed. Doesn't matter where tumor is and how long take, the cost is basically fixed. And obviously, we need to communicate everything by email through them. That's what I usually do. That's why if you hire me as your agent, as your consultant, that's what I usually do the best than anybody else. Thank you for watching my video. Anton, good luck.